Hello and welcome. You're watching Medically Speaking, and I am Meenakshi Uprepi. Cancer, a leading cause of death in our country, but something which is not very spoken about. It's a word which evokes fear in our mind, but how much do we understand prevention and even treatment of cancer? On National Cancer Awareness Day, I'd like to welcome a panel of experts. You can see them all on your screens. They are going to dispel all myths, all doubts, which all of us have had regarding the same. Now, there are 1.1 million cases that are reported each year, cancer-related cases in this country. But why is the awareness so low? Can we increase awareness on this day? Let's try it out. And we have, of course, to explain all the aspects of cancer. To explain the same, we have a panel of experts, starting with Dr. Sushil Manthania. He's a senior oncologist. I have Dr. Suman Lal, senior gynecological cancer consultant. Then I have Dr. Dodal Mandal. He is a senior consultant of cancer. He's from the Apollo Hospital. Dr. Shweta Verma. She's a mouth cancer specialist. I also have Dr. Hitesh Verma. He is an additional professor of EMT Muslim from AIMS. I'd like to welcome all of you to our discussion. And I'm going to start, first of all, Dr. Mandhania, I introduced you first, sir. You know, when we speak of cancer, it evokes a lot of fear in our minds. Of course, it's a word which many even equate with death. But there is a probability of survival, isn't it, sir? The probability is low in India, perhaps because the cases are diagnosed at an advanced stage. We know that there are less than 2/3 of cases which are diagnosed at an advanced stage. Given the backdrop of what's happening in our country, the rising number of cancer cases and the lack of awareness, the late diagnosis, how significant, how important would you say awareness really is today, sir?
As you had rightly said, there is an increase in the cancer cases in last 10 years, you can see, and there is an upward trend we are seeing in last 30 years. You can see there is a dramatic decrease in the death rates in last 50 years in cardiovascular diseases, cerebrovascular diseases, infection, but there is a very marginal decrease in malignancies, mortality in terms of death rates, decrease in death rates in cancer. So why is this so? The most important reason being is the later diagnosis, a lot of ignorance, a lot of myths about the malignancy, and a lot of time is being wasted in unnecessary alternate medications in those patients, because there is a very common saying in the malignancy. In JC cancer is diagnosed, the friends and relatives behave like experts. They start giving contradictory advices. So I think there is a lot of misconception, a lot of fear, a lot of myths about the malignancy, and that is the reason we need to create awareness among the patient. And our population is absolutely very different as compared to the Western population. I will give a very good example here. In breast cancer, you can see nearly 49% of our malignancies are in the age of less than 50 years. So this is a very different as compared to the Western population. And we have got nearly stage 3, stage 4 malignancy in breast cancer nearly to 50 to 60% of the time. Then thirdly, we have got more of the aggressive pattern as compared to the Western population. That means we have got different demographic pattern. We have got different types of malignancies, very advanced diseases. So our program has to be centered according to our local problem, local solutions.
Right. So as far as India is concerned, so you very rightly pointed out, it's the younger population, and very interestingly, which is seeing a significant rise in the number of cancer cases. That's something unlike what's happening in the Western countries. Since you spoke of breast cancer, let me bring in Dr. Suman Lal into the conversation. Dr. Lal, breast cancer, cervical cancer, number of cases, of course, rising as far as women are concerned. Urban women, we are seeing younger women also getting affected by breast cancer. In fact, I remember just a few weeks ago, I myself had moderated a discussion on Breast Cancer Awareness Month, and almost every second expert said that breast cancer is curable, but everything depends on early detection. It's not happening. Speaking of cervical cancer, a woman is dying every 8 minutes in India. This is less than the duration of the conversation which we will have today, ma'am. Really, is lack of awareness the biggest issue which you'd like to pinpoint today?
Yeah, I mean, actually, that is very important. When we talk about the gynecological cancer, like the cervical cancer and breast cancer, they're very much prevalent in India. And important part of the things is that if we detect early, we can treat the cancer properly and there's no mortality will be seen. For the cervical cancer, we generally say that it is not genetic, it is occurring because of the human papillomavirus. If we are testing for the women human papillomavirus or simple pap smear, at least 3 times a day, we can reduce the burden a lot. Even if a woman who is going for the one pap smear in their lifetime, we can detect the cancer in the society as a whole in most of the cases. But therefore, we say that all the women who are sexually active, they should go for the pap smear testing and preferably human papilloma virus testing. If it is there, then they should go to the gynecologist and get their treatment then and there rather than leaving them and going for the cancer. When we talk about the
Yeah.
breast cancer is generally the screening is very important, means the self palpation of the breast, especially after the period. That is the time if they are seeing that some lump is felt which was not there in their breast, they should go to the expert and that can be taken care. And at least if the woman is having any history of the breast cancer in the family, like the paternal or maternal, anyone, they should be more vigilant because breast cancer is genetic and they should go to the doctor and go accordingly. Not
Okay.
only the genetic BRCA1, BRCA2 genes. So many times we are not going for the gene testing, but still self palpations and palpation by the expert. And after 40 years, mammography is recommended to detect the cancer in the early stage, and therefore treatment is needed
But
that time.
ma'am, you speak of mammography, you speak of pap smear, but when we speak of India, there are two Indias really, urban as well as rural India. This infrastructure is really lacking in rural India, and perhaps that could be one of the reasons why people, one, lack of awareness, and one, really the burden on our public healthcare system. That also, is that, would you say, perhaps, Dr. Mandal, if you could come in the conversation, would you say that is also getting added on to the problem of lack of awareness? Would you say, we have the National Cancer Awareness Program. What else do you need, our policymakers need to do as far as increasing awareness and, of course, bettering infrastructure overall is also concerned, sir?
Uh, Very good question, and thank you for asking this question. See, this Cancer Awareness Day, we always talk about awareness of the part of the patients, but
Hmm.
what we forget that the similar awareness is required on the part of many other people, and it starts
Okay.
from the policymakers, the politicians, the bureaucrats, even the doctors. They're all part of the system, and until and unless the awareness is equally there, you will really not be able to control or reduce these numbers. Many times it happens that the patients actually go to a physician, but it was because of the lack of awareness on the part of the physician that it was not investigated properly. Even after diagnosis, sometimes physicians pass on comments like cancer हो गया है, कुछ होने वाला नहीं, घर पे रख लो. So these are
Hmm.
something that we should definitely focus on, and we should also try to increase the awareness on these group of people also, rather than only focusing on the patients.
Yeah.
Now, if you see the cancer landscape of our country, the major cancers are breast cancer, cervical cancer, and oral cancer or urinary cancer. Now, other than
Yeah.
breast cancer, cervical cancer and oral cancer, they are preventable. You can prevent cervical cancer by preventing the infection with human papilloma virus. You can start vaccinating the young children. So there has to be a policy which should come from the bureaucrats and that administrative level. Now talking about the oral cancer, majority of the oral cancers are because of use of tobacco in any form, like chewable tobacco, smoking, and using betel nuts. We know North India is notorious for using betel nuts. Thukku, you must have seen the image of Mr. Thukku quoted in Indian railway stations. So we need enforcement. So law is there. It's not that there is no law or rules. So we need
It's
enforcement.
enforcement.
Okay,
All
so
right.
that should come from administration, not from the doctors or from the patients. So we need to work together on all these fronts, and only then we'll be able to say that this is actually increasing the awareness.
Right. So holistic approach, and a very approach which takes everyone together, be it policymakers, be it awareness on the part of doctors, and even, of course, most importantly, the general public, is what is the need of the hour. I think, sir, you very succinctly put it. You touched upon oral cancer. Let me bring in Dr. Verma into the conversation at this point of time. Dr. Shweta Verma, since you're a mouth cancer specialist, ma'am, as Dr. Mandru just explained, mouth cancer, one of the biggest reasons is tobacco abuse. We have, of course, pictorial warnings on cigarette packs. We have I think, as far as tobacco abuse is concerned, the government is doing over and above what it can to stop people from consuming tobacco and tobacco products. But it doesn't seem to be working. Where do you think we are failing? And what more needs to be done, ma'am, since we're right now in the first part focusing on the awareness bit?
Hello. As we all know, tobacco chewing, gutka chewing, and alcohol, even alcohol intake, are one of the very main reasons of oral cancer. Besides, we have more reasons also, but these are the main ones. So, as per your question, that there are warnings on the packets and everywhere it is, awareness logos are everywhere, but still it is not working. At the very early stages in the school level, when you create these kind of awareness, then we can see an effect on these things. Plus, yes, government is doing everything. The more reasons of oral cancers are not just tobacco and alcohol. Yes, they are the biggest reasons. Others are poor oral hygiene and human papillomavirus also, because in case of oral sex or maybe sex with multiple partners, HPV is also the reason of oral cancer also. Plus dental hygiene को लेके जो people are not spending time and not awareness, like hygiene, tongue hygiene, teeth hygiene. So these are all interrelated. So dental visit once in a year can help people a lot, because we can look at the insight, what is there and what is not. So yes, oral cancer awareness is, I think, should start from the school level, because those kids, when they grow up, then they will start these things, tobacco, alcohol, not at the school level. So
absolutely. So it has to start early. Awareness is not something which is brought in about a year, and it's a longer process, and that is to follow what is needed. Fair enough. I think it's a very pertinent point, ma'am. Dr. Hitesh Verma, since we are speaking of awareness, as of now in the first part of our debate, help us understand, if a person is aware, if they detect their cancer early, how can it really help not just the patient, also the patient's family, sir, isn't it? Because it not only is going to reduce the risk of death significantly, it's also going to really help the family with the amount they could have incurred in curing the patient, isn't it, sir, when we speak of early detection? Dr. Verma.
This is a very important question, because if cancer is detected at very early stage, then the chances of cure is very high. We have different treatment modalities like surgery, chemotherapy, and radiotherapy. In early stage, one mode of treatment is sufficient enough, either surgery or either radiotherapy. But when tumor advances, then there are chances patient would require big surgery, prolonged surgery, and additional treatment therapy like radiotherapy or chemotherapy. So when disease is identified very early stage, then the chances of survival is very good. But when the disease advances like stage 3 or stage 4 diseases, then chances of survival will reduce by 10 and 20 folds, we can say, in 5-year period.
Well, absolutely. And that is why, viewers, it is early detection, it's awareness, which is very important. And that's really the crux of these days, why we have awareness days, why we are even speaking of cancer today. That really was the goal. Dr. Bandhania, since we have now started touching upon the treatment part, help us understand, and I know there are various types of cancer, so we cannot talk about cancer very generically, Dr. Mandhania, but tell us really in layman's term the difference between someone perhaps who has is afflicted with cancer, and I wouldn't go into which part, discuss perhaps breast and cervical cancer, but if someone is detected with cancer, what's the difference between the treatment they would receive if they detected early versus the difference, of course, if they go for a stage 3 or stage 4 diagnosis, sir?
It's a gross difference, and that difference is between the long-term outcome. So when we talk about stage 1, stage 2 disease, the treatment is mostly curative. And when we go into stage 3 and stage 4, the stage 3 generally is locally advanced disease. and the stage 4 is generally stage 4 is metastatic disease. So in stage 4, we are talking not about the cure. We are talking about the good quality of life and good control generally. So the difference here is the how early we are going to catch it. And if we talk about early stage disease in for most of the solid organs, the treatment is surgery, surgery, and surgery. So that has to be taken into mind, because most of the time when we talk about surgery in breast, in oral cavity, or maybe in lung, maybe in GI malignancies, the most of the time patients are very afraid of malignancies, and there is a lot of myths about the cancer and surgery. There are two major myths. कैंसर को छेड़ना नहीं, कैंसर का औजार लगाने से कैंसर फैलता है. This is very,
Yes.
very common in rural
And
population.
I've heard that too. That's right.
Yeah. It's very common, and even educated people have this myth. So when the doctor, generally we see cancer at very early stages in some patients, but they don't turn back. They generally, once we give them the correct treatment plan, yes, you will require surgery, maybe oral, breast, or GI malignancies, they are very, very curable at early stage. But generally, then once they go back to home, then the expert opinions start coming in from the nooks and corners of the society. No, surgery should not be done. There was one patient who did surgery, he died. So they take that as examples and generally go to alternate medications. And I had seen most of the time, nearly 3 to 6 months are wasted in very important months are wasted in alternate medications, and they do turn back to us. But now that is a stage 1 disease has gone into stage 3 and stage 4. So the treatment protocol and or modality will change. I will talk about headache, malignancy of breast. If there is it is locally advanced disease, then surgery is out on the baseline. Then comes the role of chemotherapy, which was not supposed to be given at stage 1 disease. So that means the crux of our discussion should be early diagnosis is the part towards cure. So our ultimate aim should
early diagnosis itself, of course, plays a major part towards cure, and that I completely agree with you on that point, sir. And since we're speaking of early diagnosis, Dr. Lal, as far as breast cancer is concerned, we all know, we need to do self-examination. If you find a lump, then you need to immediately go to a doctor. But cervical cancer, there are HPV vaccines as well, and they're ideally given between a certain age, when post-teenage, when younger.
When we talk about the cervical cancer, mostly I'm a gynecologist, and we have a responsibility to increase the awareness. That I feel that first we should start in the curriculum to go for the safe sex. When the women are starting the sex and they are using the contraception as the condom or other things, the chances of transmitting the virus will be less. So therefore, in the school curriculum, if they will be discussed about the safe sex, is a very important. In the teen, if we are going for the cervical cancer vaccination, then 70 to 80% cancer will be prevented in their later life. And then when women are coming to us, like for the pregnancy, for infertility, for other reasons, we should give a pause and take the history. If they are having some genetic history, we should talk about the cancer, which are genetic. We should examine them once. If we are feeling that the cervix is having the lesion, we can talk about the cervical cancer, and we can talk about the pap smear, significant of the pap smear, and we can examine the breast as at that time. And that will really make a sense that we can diagnose so many cancer at that stage.
Does vaccination significantly reduce the risk of cervical cancer, ma'am, the HPV vaccine?
Yeah. If a woman is taking the cervical cancer vaccine, the 70% of the cervical cancer is reduced for them. So therefore, if we are vaccinating the 100% of our young population, especially the female population, and the cervical cancer burden will be reduced by 70%. For the rest 30%, pap smear examinations in their life is very important, and that we have to explain when we are providing them the vaccination as well. The sex education at the time of providing the vaccination is very important for the young girl.
Okay, all right. So it's basically sex education. It's education. That's something Dr. Varma had also spoken about, how we need to start, creating awareness from a very younger and a tender age, so that it's implemented through the life. Point taken, ma'am. Dr. Mandal, since we are speaking of various types of treatment, as I was reading up a little bit about your profile, we also got to know you're a proton beam therapy expert, sir. What exactly is this therapy? And as far as traditional radiation is concerned, what is the difference? How can a patient decide what treatment or therapy should they go for? How do you make that decision, sir?
See, it's a very difficult technical question, and my straightforward
Okay.
suggestion is patients should not come with any preoccupation that I will get treated with this or I get treated with that. It should best be left on the expert on radiation, and the difference between proton and conventional radiation, which is mostly X-ray based. So we need to understand that it's not like anything magical which can cure each and everything. It's a different type of radiation where the radiation is much more precise than the conventional radiation, and eventually it reduces the side effects of radiation. Now, whenever it reduces the side effect of radiation, you can actually intensify the treatment. So probably higher dose of radiation can be given, or because of the reduced side effects, a patient can have a better quality of life. Now, a straightforward recommendation is any childhood patient, cancer patient, or pediatric cancer patient should be treated with proton if the proton radiation facility is available. Also, you need to remember the cost, which is definitely very high compared to the conventional radiation. So, depending on the cost, depending on the
Okay, so we're having some disturbance in your audio. I think it's a network issue, but yes. Okay, yes.
So depending on the
okay,
cost,
as far as cost availability is concerned, the decision, of course, end of the day, we should leave it out to the expert.
Exactly. Radiation
Dr. Manju, I think there is an audio issue. We'll come back to you, sir. What will you say to all those people who say perhaps waste that crucial time which they can utilize going to a professional, listening to a specialist? What do we do, sir, to dispel all these myths around cancer, sir? Because in many people's mind, cancer also equals to simply death. The moment they detect that they have so many, and I know someone in my family personally literally lost the will to live because they thought there was no chance they could survive, and they have survived with just radiation.
Yes, cancer treatment is primarily allopathic treatment. So surgery, radiotherapy, and chemotherapy are the part of treatment. Mm-hmm. So whenever you feel there is some kind of abnormal thing in your any body part which is persisting for a period of time, like swelling, ulcer, and any pain and all that, so in that case, person should visit some allopathic doctor. So that for any cancer, if it is an early stage, biopsy is must required, which is done primarily by a surgeon. So in that case, diagnosis will be developed in early stage. So the chances of cure is very high, because in early stage we can remove that part and patient with a limited morbidity, and which will improve the quality of life subsequent period. But when the cancer is in an advanced stage, in that case, the burden of surgery is very high. Like excision is wide, the patient would require some kind of flaps which can close a defect, and in post-op period some kind of radiotherapy and combination with chemotherapy also. So it will be create much burden on the patient itself, on the society, and on the government if it is diagnosed at relatively later stages.
Well, absolutely. And that really is the focus of the show also. And as we're reaching the fag end of the show, so Dr. Mandhania, I'd like to ask you, we are speaking of early detection, we're speaking of mammography, we're speaking of pap smears, we've also spoken of even how small dental visits can help. But these facilities are not really available in rural India. People have to walk kilometers just to even reach a district hospital for basic health care. Primary health centers, I'm pretty sure, do not provide these facilities. What should people in rural India do? They certainly are at a huge disadvantage. Do you see early detection increasing in rural India? What really do we need to do, sir?
Fortunately, I had worked in villages for 2 years, and that was a very tribal village in very deep of the Gadchuri jungles. So I know exactly what is the problem in the rural population. That they have anything to eat, so the health is not a problem, not a priority for them. So how we should target them? The most important thing is that there are two ways of targeting. One is to target the local PSC doctor, because every hospital, every public health center in Maharashtra have a qualified MBBS doctor. That is a fantastic thing about Maharashtra. Second thing is we need to train and motivate the community leaders. because generally they will not hear of the doctors, but they will definitely hear about the religious leaders, community leaders. And if you can train them, I think that will create a lot of awareness, and they can act as a bridge between the doctors and the patient. Because if the patient says they are very afraid of telling to the doctor, I have a lump, they are shy about saying the male doctor about the having lump in breast, or they are having vaginal discharge, or having bleeding, or having something, but they are very openly, they can disclose this with their female or maybe community leaders. One thing. Second thing, what we did was we started a program here. We started training all rural medical doctors who were posted in public health center, in public health offices, which have a population of approximately 25,000 in whole of the PSC, and each PSC has got 8 to 10 sub-centers. So if you can train a single doctor in terms of, we don't need a very good infrastructure for that. We don't need mammography machines for that. We need a very good doctor who can have a proper history. If the patient can tell, I have got a lump in breast, or I'm having a abnormal bleeding, or if I'm having a constant cough for last 3 months, or maybe X-ray can tell you that there is a fluid in the chest, then definitely if you can refer that patient to a right place at right time, even that can save a lot of precious life. So we should not just harp upon for having mammography in rural population. Awareness of the doctors also is very, very important, because if we can do that, we can catch these patients.
All right. An engagement of the community, and of course, including the primary health centers, even ASHA workers, is what is needed, sir. A point taken, sir. We're reaching the fag end of a program. I'm just going to take a last closing comment from, the other doctors also on the panel. Dr. Lal, since we spoke about the significance of vaccination, any last word which you'd like to tell people who are watching the show, especially as Dr. Mandhania spoke about rural population, their health is not the priority. Another, a part of our population, women, they do not prioritize their health. What would you like to say to the women who are watching the show, perhaps, ma'am, today?
Now the vaccination is not given by the government, therefore they are very costly. If our government will make the vaccinations free of cost, and that the vaccination which we are doing for the children, they are free of cost, and if we can give the cervical cancer vaccination to the young girl free of cost, I think we can save lots of life and future cancer load in the society. So therefore, it is my sincere request to make this vaccinations free for the rural population, and it should be mandatory for all the young girls 9 years to 11 years or less than 12 years by the pediatrician there or by the secretary.
All right. That's a very significant advice, and I hope the policymakers do implement it. Dr. Mandal, last word to you. What will be your closing comment? What will be the advice you'd like to give the people, perhaps, who are watching the show? Early detection is key, as we have emphasized through the program, isn't it, sir?
So my advices will be: biopsy should be done whenever required, surgery should be done whenever required, radiation has to be given whenever required, chemotherapy has to be administered whenever required, and early detection and proper treatment. This is very important. Early detection and proper treatment at a specialized center under experienced team of doctors will lead to success.
Well, early detection, and of course, as far as reaching the right specialized doctors at the right time is key, sir. Dr. Varma, you've spoken about the significance of basic dental visits, not ignoring even the slightest warning sign. Ma'am, what will you say as your last closing comment? Oral cancer really is something which can be cured at an early stage very, very easily. Death's very preventable, ma'am. What would you like to say as we close the show?
Okay, so regarding oral cancer, my advice is, as we all know, but we may or may not apply, is to avoid tobacco at all. And it's not healthy at all in any terms for your body. Avoid alcohol, and if you are still taking it, very limited, and very limited amount of alcohol you should consume. Regarding oral health is a major sign, and it's basically a gateway to see your oral health. Once a year, visit your dentist, and he or she can analyze your oral health also, and in any case any oral cancer symptoms which you are not aware of and which are very little, but you are not getting those symptoms, so he or she can look insight into. And plus HPV is also a major reason for oral cancer because of multiple sex partners and oral sex. So we should have a proper education and awareness regarding these kind of physical activity which the young kids get into. And oral hygiene maintenance, brush twice a day. If you see any lesion, any white or red patch on your tongue, on your cheek, and on the lips, and which is not healing within a 2 to 3 week period, then you must visit your dentist, because this could be an early sign of oral cancer. Detecting oral cancer at an early stage will help you in the treatment, in the recovery, and yes, of course, with a better lifestyle. If you are avoiding those symptoms, then definitely you will end up into surgeries and radiation and chemotherapy. So early awareness during the school period, when at a teenage stage of a person, will really help with all these things. So I think these are the ones which I want to categorize.
Fine, fair enough. Now, last word, Dr. Hitesh Verma, sir, would you like to add to any lifestyle modification which have been suggested just now? Can lifestyle modifications at all reduce the chances of getting cancer, sir?
Yes, lifestyle modification is very much important. Like we have so many kind of preserved food and salty foods, which are responsible for some or other part. There is a risk of malignancy, like in digestive tract malignancies, there are high chances with these preserved foods. So lifestyle modification, healthy lifestyle, regular exercise is very important. So the risk of acidity and related changes in the mucosa is less. And like breathing exercises, which helps in cleaning the airway and which improves the chances of correction of the mucosa, which are changes occur because of this environmental changes, which we have seen in recent time era because of pollution and even with the smoke. If you're feeling something abnormal in the entire body system, which is persisting over a period of time, maybe 2 to 3 weeks, then you should you should visit your doctor so that they can check if anything is abnormal. If doctor suggests after examination so everything is okay, then you can go ahead. Otherwise, early detection is possible if you go to your doctor at early stage of your symptoms, and the chances of cure is very high because the disease is limited, and you have single modality of treatment rather than using multiple modalities and exhausting all of your treatment. So single modality is the best treatment. If you are exhausting all the modalities, then the chances of if the disease is recurring even after first modality, then the chances of management in further recurrence is very less.
Becomes more difficult. Absolutely. So we've come a full circle. We started with emphasizing on early detection, and we've ended with the same. Perhaps, of course, added on with lifestyle modifications, it can go a large way, not only in curing, perhaps, but even ensuring that you do not go for expensive surgeries. Your family doesn't suffer with you. Be it reducing cost, be it reducing, of course, not just the economic burden, but increasing the chances of survival. Early detection is key. I hope we have been able to create some awareness on a special day like this. I'd like to thank all my experts for joining us with their opinion and taking out time for speaking to us on NewsX. Thank you so much.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.